Hey there, my name is Tim Tialdo, and I've been invited to share with you the basic details of a very profitable financial health strategy that is treating the economic pain of the current healthcare industry shifts, creating a sustained revenue stream for our healthcare providers. Uncertainty in the medical field has put a tremendous strain on doctors everywhere. Insurance premiums are increasing, reimbursements are decreasing. There is constant worry of having to deal with unfounded malpractice lawsuits, forcing doctors to spend less time with their patients and more time with paperwork. Practices are seriously threatened with the declining payments, the escalating expenses, and decreasing patient volumes. We recognize that you are trying to prepare, but no one can anticipate what they are preparing for. The reimbursement plan that I'm about to review with you is deep-seated with many bells and whistles, unlike things that most healthcare providers are ever used to hearing about. I'm referring to reimbursements that are not just significant in cash, but lifestyle compensation valued at over $1 million, literally fulfilling lifestyle dreams physicians never imagined possible during these economic times. Yes, there is light at the end of the tunnel, so my objective is to give you the very simple understanding so you can appreciate the income potential that lies before you. The first type of revenue you will benefit from with Unicity International is called active income. Active income would be a result of a patient purchasing BIOS Life Slim or enrolling in the Unicity 13-week Healthy Weight Loss and Wellness Program. This can be done on-site in your office or through your provider account online at mydoctorsrx.com. For every patient that obtains BIOS Life Slim on-site, your net profit would range from $50 to $65 per month supply. For every patient that obtains BIOS Life Slim online, your net profit would range from $30 to $65 per month supply. For every patient enrolled in the 13-week program, your earnings would yield you between $200 and $350. The revenues can become quite substantial with this program because it is pure profit, no additional staff needed, no added overhead. In fact, it would inspire added office visit revenue that you could bill for if you bring back your patient once a month during the 13-week program to evaluate their progress, which many of our physicians currently do. So for example, let's observe the earnings you would yield if you had 30 patients enrolled in the program. That's $6,000. 60 patients enrolled, $12,000. 90 patients enrolled, $18,000. Now, remember what I said, pure profit, cash, no insurance, no added overhead. Now, the second type of income is more important for your long-term financial security, and that is passive income. But the whole objective with Unicity International is to give you time freedom so you can generate revenue that comes to you regardless of your daily activity. The challenge for physicians is they are stuck in a linear income environment, exchanging time for money. When you see patients, you get paid. You take a week off, revenue stops. The overhead doesn't go away. Whether you're out on the golf course, spending time with your family, or on a vacation, the brilliance of passive income is that you work and refer once and get paid forever. Now, here's something you can probably relate to. I was speaking with this physician who practiced 25 years. He saw an average of 30 patients a day, 4 days a week. That equates to over 140,000 patients treated over the span of his career. Now, you can only imagine the number of prescriptions written over the years, and the number of refills. Visualize if he had received just a small compensation for every refill. Wow, I think his retirement fund would have looked a whole lot different. Now keep in mind, Unicity has been in existence for over 2 decades. Historically, the retention rate of patients staying on the BIOS Life Slim product has been extraordinary. When a patient experiences a dramatic improvement in their cholesterol or glucose numbers, no different than needing to refill their costly prescription medications, they're going to refill their BIOS Life, which is not just more cost-effective, but has many long-term side benefits versus expensive medications that have many long-term side effects. And patients are happy when they learn they can use their flexible spending account or health savings for their purchase. So the transition to the refill process is simple. Unicity International has implemented a preferred patient program. The patient is inspired to go into the program because they get a 15% discount and free shipping. Meanwhile, for every refill, you will receive a reimbursement of $30. Now keep something in mind. As patients come and go in your practice due to their insurance changes or whatever the case may be, they are forever connected to your provider account number in the computer system at Unicity, regardless of who their new physician may be. So just imagine 100 patients on refill times $30 per refill. That nets you $3,000 monthly, a completely passive income. But if you're looking to maximize the earnings offered by Unicity's Healthcare Providers Program, you can take it one step further if you choose to. Of course, you can limit yourself to just your own practice, but you can seriously increase your passive income quickly, expanding with a colleague team of your referring physicians. One thing we have observed is that our providers have a hard time keeping this a secret from each other. In fact, our business trend for years has confirmed that our physicians refer an average of 8 to 10 colleagues. They are so impressed with their patients' weight loss, lipids, and glucose improvements, they don't keep it a secret from the other physicians. So here's what that translates into. You would receive anywhere from 3 to 30% of added monthly income from patient orders and consumption moved through the other practices you referred to Unicity. Corporate does all the bookkeeping and refilling. You simply do the referring. Now we have physicians that do thousands of dollars per month in patient consumption and refills, hundreds and hundreds of patients and products. But just to paint a visual picture for example purposes, let me demonstrate the passive income you would experience if you only referred 5 practices and they only had 50 patients on BiosLife Slim. And this isn't even counting the other product consumption that also takes place. You would earn 5% for each box of BiosLife Slim sold through the referred practices. 5 practices with 50 patients earns you $650. Now these 5 physicians most likely will refer 5, and now you're earning on 25 practices. 25 practices with 50 patients equals $3,250. And of course, these providers will do the same, and now you are earning on 125 practices. 125 practices with 50 patients is $16,250. Now, this is just a snapshot of the growth potential. Look at what happens when you refer to the 13-week program. Applying the same principle with the 13-week coaching program, referring 5 practices, and let's not even use the 50 patients, let's base this on a 30-patient model. As I said earlier, most providers end up referring 8 to 10, but we're basing this on 5 provider referrals. It's a good thing you're sitting down because when you see these numbers multiply, it gets very exciting for our physicians. Okay, so let's look at 5 practices with 30 patients. You would earn 5% for every one of their patients in the program, and that's $3,750. Now, these 5 physicians most likely will refer at least 5. And now you are earning on 25 practices. 25 practices with 30 patients is $18,750. And of course, these providers will do the same, and now you're earning on 125 practices. 125 practices with 30 patients totals, ready for this, $93,750. So I realize you probably can't even conceptualize how this can translate into those types of revenues, but it does. The compensation I just described is very accurate and extremely predictable. It's important that you realize the potential that lies before you. Healthcare isn't getting any easier, and you're not getting any younger. Listen to your own heart. Ask yourself, is what I'm doing today going to put me where I want to be 20 years from now? If you're concerned, then I suggest you not waste a moment. Establish a provider account number now. Your out-of-pocket to do this will be $40. This account enables you the privilege to refer your patients to the company, where they can order directly online at mydoctorsrx.com using your ID number, and you receive the financial benefit. The account also enables you to refer your colleagues, so they can integrate into their practices where, again, you receive the financial benefit. The corporate office will track all of their practice growth and simply pay you monthly based upon their productivity. You have no record keeping to worry about. And it gives you the privilege to buy the product wholesale for yourself and your practice. The wholesale price of BiosLife Slim is $69. Now, many of our physicians choose to have product on site in the office. Historically, when the patient sees the product promoted in the office, they want it that day. For this reason, specifically priced physician packages are available. The first package is a 25-box pack. That's $1,745. You will get a $96 rebate. Your sales revenue will be $3,050, so your net profit is $1,401. Now, considering the rebate and earnings, this brings your cost per box from $69 down to $65. The second physician's package is the 50-pack. That's $3,470. You will receive a rebate of $492. Your sales revenue will be $6,100, so your net profit is $3,122. Your cost per box ends up running you $59. The final package is the 100-pack. This is generally the most popular package because it yields the highest rebate, which ultimately brings the price per box down from $69 wholesale all the way down to $56 wholesale, enabling a much more significant profit margin. Most physicians realize they will probably have at least 3 to 5 people in a day obtaining product, so it makes sense to go with this pack to last them through the first 4 to 6 weeks. So the 100 pack runs $6,900. You will receive a rebate of $1,282.50. Your sales revenue will be $12,200 for a net profit of $6,582.50. Your cost per box ends up running you $56. So there you have it. I'm sure you've come to the logical conclusion that affiliating with Unicity International to improve your patient outcomes and simultaneously improve your practice incomes is going to be a smart decision. So here are your next steps. 1. Establish a healthcare provider account and enroll using their provider number of the person that referred you. Number 2. Determine if you wish to have product on site, and if so, order an appropriate healthcare package. Number 3. Discuss with your referring colleague if you wish to limit your affiliation to simply your own practice or if you have the desire to develop a referral colleague network. Number 4. If you wish to develop the network, then set up a strategy call to meet with additional partners you would be working with. And number 5. Make the decision that is right for you. Whatever you choose, your Unicity partners are here to support you. Thanks for taking the time to review the reimbursement program. We look forward to working with you and making this a profitable scenario you can enjoy.